for abstracts, a quantitative approach, a qualitative approach, and a DNP project approach for abstract writing. And we are going to focus mostly on abstract writing for conferences, but also we're going to add a part that's going to include writing an abstract if you're submitting to a peer-reviewed journal towards the end. So my name is Marie Adorno, and I am a faculty member at Louisiana State University Health Sciences Center in New Orleans, Louisiana. And I am working with Dr. Kang with this particular presentation. So I'm going to turn it over to Dr. Kang to introduce herself and start off the presentation.
Okay, thank you, Marie. Hello, everybody. My name is JungHee Kang from University of Kentucky College of Nursing. My research interest area is role of diet in chronic diseases such as cancer and cardiovascular diseases. I'm so honored to be here to share my experience about writing effective abstract, quantitative approaches, and Dr. Adorno will present about qualitative approaches. And if you have any questions, I will present first, and then Dr. Adorno will present, and then if you guys are okay, we will have get all those questions at the end. So the objective of my part is participants will learn how to write effective quantitative abstract for research study, and participants will understand the key components of a quantitative research project. And participants will identify essential elements to include and common pitfalls to avoid when submitting quantitative abstracts to professional conferences and peer-reviewed journals, like Dr. Adorno mentioned. So basically, when we talk about just overall, the abstract summarizes usually in 250 words or less, like when we talk about the journal. And conferences, they usually these days talk with about like characters more instead of words. So it would be like 2,500 characters, including all those spaces altogether, or 3,000. International or national conferences allow a little bit more spaces. So they go with the 3,000 or 3,500 characters, including spaces and the symbols and everything. So the major aspect of the full article, like about your research project, right? So because your goal is not just writing abstract and finish it, but you want to develop that one as a paper so that you can have your scholarship work completed, right? So abstract is a self-contained, short, and powerful summary of your research project or manuscript. So while format varies by journal or conference, many follow the IMRAD structure, which is I, introduction or background, and M is methods, and R is results, and D, discussion or conclusions together. So introduction is a key sentence about what is known and what is not known about subject, right? Because you want to talk about something is not known so that you can say, this is not known, so I want to focus on this one to explore or to determine this relationship like that, right? And then that leads to overall purpose of the study. And method section is method and design. Readers should be able to understand what was done and how it is done. And then results is one of the main component like methods, major findings actually, what you found from your study. Usually the majority of abstract is dedicated to this part. And discussion is not the repetition of the results, but it is more likely interpretation. I will talk about it a little bit more in detail part. Interpretation of the findings related to the primary outcome and conclusion. Other important or unexpected findings can also be mentioned, but not just all of a sudden surprise. Even if it's unexpected findings, then it needs to be introduced in results, and then you can discuss about it. So background work, so you need to check, right? You need to review the call for abstract guidelines, like just it was mentioned. What is a component? What is the guideline that SNRS? Because your goal is right now the SNRS, right? And maybe some of you might be going for other meetings and national or international meetings as well. But you need to check what is their call, what kind of abstract, what kind of study they want. If it is completed study, or if it is okay with review kind of journal review work, right? So that you need to check purpose of the meeting. So in our SNRS case, it is nursing, right? So it is nursing research and nursing practice as well. And audience, who is the audience, right? And it will be more like a nursing and then allied health related to nursing area, I would assume. But most like it's nursing in our SNRS case. And then you need to check the format and including word limit. And how is the abstract submitted, how is the process goes, and also that what is required there. Maybe there might be some fees. I think SNRS requires like $25 fees. So make sure if you're working with your mentor and if your mentor is supporting you, then check with her or him, can you support me? Or if you're willing to pay for that part to present your work in front of all those your colleagues currently or future colleagues as well. And also, if it is database studies or if it is only completed studies, it's required, right? And you plan ahead because it takes time to write. Not only write, also it takes time to analyze all those data, that work you have done. Maybe sometimes you might want to modify the analysis as well. So give enough time to do those work. And experience helps. So work with a mentor or colleagues. It is really, really helpful. In my case, really, I was part of a rich heart program. It was research and intervention for cardiovascular health, and that our team was always when we write abstract, before we submit, we always check with the mentors or peer colleagues as well. And then when we get accepted, we prepare poster and then we go again, all those things like that. And it really made us to be strong in presenting our work. And review examples of other abstract as well. There are, for example, like because I used to work on the cardiovascular health, like heart failure, circulation heart failure, or PCNA, those places, they share abstract examples. So you can go and check. If you are not sure, then you can also go to the Google search and then say like abstract examples, or you can put nursing abstract examples as well, and go for perfection and precision. Okay. So other considerations, the conference participants read your abstract to decide whether they will attend to see your presentation, right? And then they will come. So kind of you need to make it to be attractive, and also kind of people can see from your title, oh, maybe this is what he did or what she did, so that they can easily check yours and then come to talk to you as well, to listen to your presentation as well. An abstract may be published in a journal associated with the conference. Currently, SNRS is not, but like, for example, American Heart Association or European Society of Cardiology, those places always, also American Association of Cancer Research, if your abstract is submitted, that comes to their related journal and as a publication. So which is also very good for you to have that experience and also put on your CV. Peer review process, you need to find the evaluation criteria, right? So that reviewers will look for, because the reviewers are like similar to you, but maybe a little bit have a more experience, right? But they have also lots of work to do, working with the students and then do all those administrative work as well. So they finish all those work and then maybe at nighttime before they go to bed, they will, try to finish all those reviewing part. So you want to be, you want them to see like, oh, this is interesting. I think this is important, right? So you need to kind of give an informative title and significant problem. What is problem? You can kind of let them think immediately, and also clearly written abstract, and also what kind of data that you use, they can kind of immediately see. And also, if possible, like striking conclusion that builds on data, right? They are most likely but expert in your specific area of research, but they are most likely not really, because you are the expert in your study, right? So you kind of want them to easily understand, right? So don't use a jargon unique to your area. Don't assume that everyone understands why your study is important. and also try to avoid writing in a highly technical, obscure manner, or simple, straightforward, the small words, no wasted words is always preferred, and provide the information in every word if possible. So, oh, yes. So this part is I pulled out from the SNRS category. So you may be able to see when you go to the SNRS website as well. Just in case I kind of put it here. So category is when the reviewers are seeing your abstract, this is the category they will check about the significance and research question or objective, methodology, and results, outcomes, and conclusions and discussion. So these are the ones, if you can describe like this much, you will get all perfect points. So try to meet this criteria, okay? I will emphasize again, but always very important one is be consistent. From the introduction, your introduction is to introduce your purpose of the study, aim of the study, right? And then based on that aim, your methodology will come with that, right? And then based on that, your aim, your result will go with that aim, right? You want to introduce what you aimed for, right? And then based on that result, your conclusion will come out. So be consistent, not only this about this category part, but also in the terms as well. Like my mentor, Dr. Deborah Moser, she was always saying like, she's a big person in depressive symptom area. So in the beginning, I had no idea, right? I was using depression and depressive symptom, and she said, JungHee, depression is not the same as depressive symptoms. So when you talk about it, you need to put depressive symptoms from the beginning until the end. Do not use all different ones. And also my senior colleague also told me like, JungHee, I was always proud of myself because I was so good at writing essays. And then when I wrote my first paper, I got crushed because they said like, you cannot use all different terms, because she was trying to use all different expression to express the same term, right? But in the research, especially quantitative research study, I think it would be similar to qualitative. Use the term consistently, okay? So title, as we talked about it, it needs to make it interesting and informative, right? For example, associations among stress, diet quality, and inflammation. And maybe if that space allows, then you might introduce what the analysis, especially if you're going for the manuscript, these days it's quite required to put what kind of analysis you applied for it as well. And then also you can do this way, like really informing what you found kind of way. So diet quality mediates the association of stress with inflammation, right? Then people will immediately say, oh, this is what she found, right? And I want to know about it more. But also some journals are like, this was kind of quite preferred for a while, but these days some journals are saying like, or some conferences are saying like, do not really put exact findings, everything clearly. So you could also say like this way, question kind of way. Does diet quality mediate the association between stress and inflammation? And people might be like, I want to know if it is really mediating or if it's not, right? So you can choose what you think it would be more informative or more interesting. So SNRS, kind of the criteria when I checked, it is title, you need to write as a title case only will be accepted for abstract titles, which means capitalize the first letter of words, as I kind of wrote on the top part, other than the short conjunctions. So articles and prepositions. So as you can see on the top, I did not use capital letter on the and or the or of or with, right? But other words that I used capital letter in the beginning. And the SNRS kind of kind of you need to be careful about this. Their title word number is limited to 10 words. So you want to use really wisely. When I did one time last year, my actually measurement had so many words. Like I was using TMAO, which was already like 3-4 words, and then each term was like 2-3 words, right? So I could not even add associations among or in the association of kind of like that. So try to put most important ones, and then try to express as much as possible. So in the introduction or significance or background, AD is usually as analysis limiting to 300 characters. So it will be around 2 to 3 sentences you can use. So you want to use that one to express what is known, what is not known, and what is the issue or what you are going to work on, right? So be specific and be really like succinct. So use a problem statement approach. Like for example, despite the fact that something little is known about, or something is not well elucidated, or something is not well known, right? Or something needs to be more explored, kind of the way. So for example, it is kind of one of my example. So this one says depression is common in patients with cardiovascular disease and is also associated with inflammation. So kind of people can see like, oh, she's going to talk about depression or depressive symptoms, right? And also cardiovascular disease and inflammation. And inflammation contributes to the development of CVD. So you want to make sure they are connected together, right? And can be modulated by diet. So people will think, oh, maybe she's going to focus on diet. However, the role of the inflammatory properties of diet between depressive symptoms and CVD risk is not well known, right? So this is example. I'm not saying you have to do it like this, but this is example for to help you to think about how to present your work, okay? So purpose, that leads to your purpose statement, right? So in the purpose statement, you need to make sure you include the independent variable and dependent variable and your sample or target population, right? And sometimes you may have some additional variables like a mediator or moderator, mediation variable or moderation variables. So for example, we aimed to test the hypothesis. Usually your purpose statement comes with a hypothesis, right? Hypothesis that diet quality mediates the relationship between chronic stress and inflammation. So I put what is the starting point, right? It is chronic stress. And what is your outcome? Inflammation, right? And what is your sample? It is patient with a metabolic syndrome. So that you need to make sure that you want to make sure these are clearly written in the purpose statement. In SNRS, I think a purpose statement allows up to, I think it's 500 characters. So you have a space. Sometimes some people have like 2-3 different aims or purposes. So then you can use those things using 1, 2, 3. So here's one example I did before. So the purpose of the study were the purposes of the study were to examine whether the inflammatory properties of diet mediate the relationship between depressive symptoms and CVD risk, and determine if there is a gender difference in the mediation effect, right? So you can use multiple purposes in this kind of way as well. In this one, I did not put exactly like a sample or target population because I was using big data, national survey data. So it was a general population, so I did not specifically write here. And then method section is design. You need to include your study design procedure. If it is especially intervention study, you want to say like what kind of intervention group received and what was for the control group, right? And then you need to talk about sample. What was the sample criteria, inclusion or exclusion criteria, and then your measures, what kind of terms you kind of checked. And then definitely you need to include the statistical analysis, not in the results section, okay? So here it says that, as you can see in this cross-sectional study, right? So it shows what kind of design I had, right? Or you can say like in this randomized controlled trial, if you did the intervention study, and then basically you kind of put what kind of participants basically was, and then what kind of terms you used, how it was measured, right? And also if measure is not unclear, like you mentioned, if you measure the pain, but there was not clear there, you may want to provide operational definitions if space allows. And if you had a two group comparison, you need to mention about what kind of grouping you did, right? And then the critical element is this method part and the result part as well, right? Because this one will say to reviewer or readers exactly what to expect in the results section. And it gives information about quality and strength of the study. And then data are essential in the results section, and try to minimize and avoid the sample description. Like you want to focus on your major finding, right? You don't want to talk about how many people were married, how many were, definitely that one should go to journal, the journal manuscript description, but not in the abstract, okay? And include findings that directly address the purpose. And then used in the results section. Many new students usually make a mistake on this part a lot. Please use past tense when you are describing results, okay? And avoid confusing readers by providing every bit of data. Because in the beginning, when I was also working, I wanted to describe everything I found, right? This was interesting, this was interesting. And then my mentor said, JungHee, that's interesting, but do not put it here. Maybe you can think about it for your next future study, all right? And if allowed, you can use a figure or table. Like, for example, American Heart Association, as I told you, national or international, European Society of Cardiology, they allow you to use figures because it's very good to provide visualizing effect, right? So that would make people to, that will help people to understand what you found easily, right? And then also the reviewers' attention, it will catch reviewers' attention as well. But SNRS is you need to describe in text only, okay? But bad part of using figure is it takes a lot of space. If you add one figure in the American Heart Association, that is the same as 250 spaces that you are using, okay? And here's the example. So this was actually I used for American Heart Association, right? So I described what I found and I talked about the mediation because that was my purpose, right? And then I explained what mediation meaning was, right? I said higher stress was associated with the lower diet quality. In turn, lower diet quality was increased, associated with increased inflammation, right? So this one figure was kind of explaining better. But in SNRS, when your abstract is get accepted, you can use this visualization for your presentation. And in conclusion, do not simply repeat the result, as I mentioned a little bit earlier, right? Conclusion, you need to say like what is message from these findings, right? So you need to interpret your results, and you present also implications for future research or practice, like research related implication or educational implication or clinical implications, right? That would be great. If you go to national, international presentation, and if you get chosen as a finalist or something like that, this part is very important to present in the conclusion section. But do not say things like will be discussed because you are just concluding here, okay? And I think conclusion section in SNRS is 300 characters, but method and result sections are 700 each. So here's example. Our findings indicate the importance role of diet quality in the relationship of chronic stress with inflammation in patients with a metabolic syndrome. And I said healthcare providers should encourage patients with higher stress to improve their diet quality, which can decrease inflammation, right? So those kind of implications would be nice to have. And then it will make readers and then reviewers to see like, oh, this is important part, right? That's why we learn. And also kind of I missed in that part, that when you talk about the purpose statement, please do not say this study tested, this study determined. This study is not the human, right? Your study does not test. You tested, right? So you need to say the purpose of the study was, or you say like we aimed to, or we tested, like this way, okay? That's, I think, an important part. My mentor always kind of emphasized that part. So I would like to emphasize for you guys as well. So abstract should not contain information that is not in the original work, and a lengthy background or contextual information, and redundant phrases, unnecessary adverbs or adjectives like surprisingly, interestingly. Those things you can put in your manuscript, but not in the abstract, okay? If possible, and repeated informations. And try to, I'm not saying you should not contain, but sometimes you have to use abbreviations because you have limited space to express everything you found, right? But try to limit the use of abbreviations. Too many are very distracting and confusing. And then the similar way, and then in the abstract, you do not put any citation reference to other works, okay? You do not need to add any citation there. And in summary, know your audience and reviewers, and then do proofread. You read it and you ask your friend or your colleagues or your mentors or your committee members to read as well, right? Because when you're focusing so much and then you may change some analysis, you cannot, because you are always looking at that one, but you may not be able to find it. But some other people, outside people that could second eyes, other people can't find something you might have missed. So it's always good to have those colleagues to check on your abstract, and you do for your colleague as well. And then try to get good critic, not just kind of encouraging word, but you want to have a good critic so that actually it will help your abstract to get accepted, right? And be succinct and precise. And as I told you earlier, internal consistency is essential. Strong and informative title, and concise but compelling background, knowledgeable by person, and purpose that follows from the background and informs the method and results. And conclusion relates back to purpose. Strong method section and results with informative data. Use tables or figures if you can, and to make impact when appropriate, and conclusion that interprets, not repeating, doesn't just repeat the results, right? So you submit it. Now what? Sit back and relax and wait for the announcement, okay? And I hope you guys have good abstract and get accepted. Thank you very much.
So hello, this is the second part of writing effective abstracts. So can everyone see my screen?
We can see it.
Yes.
Okay, great. And it's in the right presenter mode?
Yes, ma'am.
Okay, great. So this is the second part, which is going to reiterate some of the things Dr. Kang has just said, because in writing abstracts, no matter what type you write, whether it's qualitative for a DNP proposal, for a conference, or for a professional journal, there are similar, very, very similar components. But what I'm going to do is reinforce some of those similar components, but then I'm going to take it one step further and give you some specifics to the different types of abstracts. So my focus
Hi,
is going to be,
it's not in presenter mode.
okay. So let me see. Is that better?
Yes, thank you.
Yes.
Okay. So this is the writing effective abstracts for qualitative approaches. And then for this, participants will learn how to write an effective qualitative abstract. You'll understand the components of a DNP project abstract, and you're going to identify types of abstracts for submission to professional conferences and peer-reviewed journals. One of the things I always like to start off with a quote in reminding us what exactly we're doing. So an abstract is a succinct yet comprehensive synopsis of the contents of the prospective paper or published paper. The most important, the reason this is important is sometimes people, when they write abstracts, things, I'll just write the introduction and just kind of copy it into my abstract, and then that'll make sense to what is being done. And that is not necessarily the case. You have to make sure that you give the overview of the entire proposal. So the essential elements is keep that clear and concise writing and make sure that it's free of grammar, spelling, and punctuation errors, and that there are no reference citations. Usually the reference citations, are saved for the paper itself. You always have to make sure it's free of bias and all abbreviations are spelled out, and follow the format of where you're submitting your abstract to. So some lead sentences that are sometimes used, sometimes you can say to determine. The goal of this is, the model for improvement framework that was used is, the project included, in conclusion, these findings suggest that. All of those are just some key beginning parts of the abstract itself. So some tips for writing qualitative abstract is start strong, use active voice, and this could be for qualitative and quantitative, of course, but just still trying to be focused for this particular section on the qualitative part is always reminding you to be concise, highlight what is unique, and always end with impact. So for qualitative abstracts, you're trying to convey the essence of your research question through your problem statement and purpose. The biggest thing is, some people have asked, do I actually put the research question in my abstract? And again, depending on where you're submitting it, some instructions could state something a little differently from this, but in general, when you're writing qualitative, you're conveying that essence of your research question by writing your problem statement and purpose. And I'm going to give you a couple of examples later on in the presentation. You always want to convey the what, why, and how of your research in a concise manner. And again, it's a summary of your entire proposal. So for study design and materials and methods, for qualitative, you usually talk about the type of qualitative method that you describe that under design. You also include your sample. For qualitative, if you have small numbers, with whether you're doing interviews or depending on the design of your topic, when you discuss your sample, you're going to talk about their basic characteristics, how you selected that sample and why, inclusion and exclusion criteria for that sample selection, your data collection procedures, and how your data were analyzed. For the findings section, instead of results, usually a qualitative abstract is termed findings. Now, when you're submitting abstracts to conferences, sometimes the topic of the title still says results. You can still use their topic when you're following the rubric, but then you can be very specific that you can state, in this qualitative study, the findings were, and you can discuss that under the sets of results, because obviously results and findings could be considered the same thing, but it's just knowing that in general, in qualitative, the term is usually called findings. Basically, what you're doing is, instead of the numbers, is what Dr. Kang just spoke about with the quantitative abstracts, you're presenting the themes or a narrative description as your findings. And you're also presenting a meaning of those findings. And then that you can also have new knowledge that is gained from the quotes and the narratives and the themes. At the same time, you're not trying to fit everything into the concise format that you're trying to do, but you're trying to give an overview of everything. So again, to reiterate what Dr. Kang had said, you need to make sure that you hold the reader, you grab the reader and you talk about it. And then if something's unique or different, you can focus on that, but make sure in a way that then you still have more to write about when you're talking about it in longer format after the abstract is complete. So just to talk about a DMP abstract, and it was saying DMP meaning anything that is quality improvement, knowledge to action, DMP projects. The great thing about SNRS, their SNRS organization always embraces scholarship from doctoral students of both DNP and PhD. So if you do submit for a DMP abstract, then you usually include the background, the purpose, the project design, findings, implications, and of course the keywords. And I put on the 300-word maximum, but again, that is depending on the organization that you're submitting to. SNRS, if it's 250 words, then don't go by this. We always have students that'll come and say, well, this says this, but this is what we've always been taught in the classroom, or this is how we've been taught for other things. And it really depends on the organization and or what you're applying to for the actual details of submitting the abstract. So just to go into each of those in a little more detail is with the background for the DNP quality improvement projects, you are having the relevance for the purpose. You're talking about objectives and the gap and the need. For the project design, you may be talking about the framework and the interventions and data collection tools and data analysis. For the findings, you're talking about sample size, the actual quantitative results, numerical results, and all the different statistical values. And then for implications, you're talking about the implications for practice, research, and policy and education based on the findings. So as an overview of all these different types of abstracts, we have some common abstract weaknesses. And basically, this is kind of gives you a little reminder, because all of us can embrace our topics and then start going on and on and on. And we don't think we're going on and on and on, which is why you use some of the initiatives of getting a peer reader and a mentor, etc. But you don't want to only talk about cursory findings. You don't want to have missing information. You don't want to be too detailed, too long, or too verbose. You don't want to reuse just your paper introduction, as I had said earlier. You don't want only that, because it's not enough in itself to give the whole picture. You don't need extraneous content in the abstract. And you don't want to introduce new information in the abstract. Obviously, you don't want it to be disorganized. You don't want it to include citations, and you don't want to overstate the data, and you don't want to lack correlations of findings with the conclusion. A lot of these are obvious, but again, when you get lost in the writing, you have to be cautious to make sure you don't do any of those. So what we wanted to do, we keep talking about the conference. Want to go through just a couple of things. The link was provided by you. I'm going to see if this works from here. And for anyone who wants to consider submitting an abstract for the conference that is February 19th to 21st, you can see where we have the websites here. And when there's different spots that you click if you're going to submit the abstract, but before I click it, what I want to do is show you.
Isn't it in Austin next year?
Yes. And yes, and this is on the SNRS website. So before I click and navigate through the website, because I want to save some time for you all to be able to ask questions, I pulled up what the abstract, when you do click on submit an abstract, we keep telling you how you follow the rules of the organization and or the journal that you'd be submitting to. This is an example of following the rules. So for this, you have the abstract schedule here. And again, we had said second call for student abstracts was August 1st to September 1st. And then they give you the details there. But always when it'll even tell you, like for SNRS, you do pay a $25 fee to submit an abstract. And there's a portal where you do that. So of course you would wind up doing that too. But what happens is here it even tells you first you can create an account. And then what happens is, let me see if I can make this a little bigger. Then what happens is, depending on what type of submission you have, you follow the different guidelines that it says. And again, some things are the same and overlap. No matter what type of abstract you submit, the abstract titles are limited to a maximum of 10 words. As Dr. King said earlier, it even tells you how you have to make sure that you don't capitalize the what would be considered the prepositional words, the tos, the these, etc. If you're doing a podium presentation, there are examples. And if you're doing posters, there are examples. A lot of times when you're submitting an abstract, it will ask you, do you want to do a poster or a podium? And a lot of people put both. And then the abstract reviewers will decide You know, if your abstract is better suited for the conference theme as a poster and or a podium. And and sometimes even if you put, oh, I just want a poster, sometimes if the abstract reviewers decide this is really good, we want to ask for them to present this as a podium, that could happen too. But you do give your preference when you're submitting the abstract. And as you can see here, it talks about research podium, it talks about symposiums, and it talks about the scholarly projects, which is why we wanted to go over that briefly in the PowerPoint. I'm going to keep scrolling down. This is all on the website, but I'm going to keep scrolling down to the important part of summarizing what I'm saying. There's a lot of information here, but when you keep scrolling, okay, and you see all of the different rules associated with it, and it has a general guidelines for all submissions. Everything we've told you today is included in this handout. So even if you took notes on what we were saying, or if you have this recorded, when you go back to this, you can see this is the instructions that you would follow. But the great thing about this document, which is on the SNRS website, they'll have on there, if y'all can see this, the research related abstract, the research abstract, scholarly project abstract rubric, and pre and post conference abstract. So for example, everything that we've just talked about, let's just talk about the research abstract itself, because that's what we focused on. So let's see if I can open it from here. I'm not going to be able to open it.
And Dr. Adorno, I'm just letting you know too, I put the link for this year's conference with where to schedule in the chat. So you might be able to open it from the chat on the Zoom
Okay.
as well.
Okay, let me try one more time here, because what I'm going to do is, if it doesn't open, let's see if that opened.
This looks like it might be last year's, since it's Memphis, Tennessee, that it's taking YouTube.
Yes, and maybe that's why I was using this as an example. So I'm just to show the example, and so let me stop sharing a minute, and let me open it from your link, as you're saying. Okay, so can everybody see that link now? Am I sharing it?
Yes.
Okay. Okay, so are y'all seeing the SNS criteria for research abstracts?
No, I think maybe you are sharing your window instead of the monitor itself. So we can see the download part, but we do not see that Word file.
Okay,
Mm.
I'm sorry for this. Try to open too many things.
Okay.
How about now?
Yes.
Okay, so you're seeing the criteria. And again, don't go by this that I opened up in case I was able to open up the one that was last year's. But the point of this showing you this is, again, it's to remind you of what you're being assessed on when you submit your abstract. So it's the rubric itself, making sure you include it. And as you can see on this, because it says to include introduction, research, methodology, results, and outcomes and conclusions, that's what you would follow, and that's what you would make sure that you would include in your 250 words or whatever your word count would be for that. So I just wanted to be clear on making sure that not only do you follow the instructions, but that you follow the rubrics that are associated with that. And I just want to say a couple of more thoughts in summary, and then we're going to open for questions. Okay, and back to my PowerPoint now. So do y'all see my PowerPoint now?
It's not full mode.
And what did you say? It was not what?
It's not full screen mode. Can you click on the bottom, on the bottom right next to that magnifier part on the right side bottom? Can you just click that one? Yeah, right side, right side, right side, right.
There you go.
Yeah, I think. Oh,
Okay.
oh, this is weird.
I'm sorry. My computer's doing a little bit of crazy stuff. Okay. So can you see it now?
Yes, ma'am, it looks good.
Yes.
Okay. Okay, so that was going through the annual conference and the guidelines. The only other thing, just to give you an example, this was a previous submission that I had made to the SNRN conference a couple of years ago for a qualitative study. And again, it was following those guidelines that I had just showed you. But again, if they specifically say what is the study purpose and problem statement, you're being concise and as efficient as possible with that. And then you have when they ask for purpose, you talk about the purpose of the qualitative study. And again, in past tense, it was to identify and understand barriers to student success and the significance of it and the significance to nursing. And it was just trying to show you some examples of some summaries. But the other thing we wanted to just remind you is if you were submitting to a professional journal, just like at the conferences, how we just showed you there are rubrics and there are instructions. Every journal has what's called a guide for authors. And again, similarly to what we just told you based on word count and subtitles, you would look for that guide for authors when you're going to submit for a professional journal. So in this particular example, it even tells you before you begin, and you all can see this for the Journal of Professional, I just picked a journal, one of the journals that I've submitted to for the Journal of Professional Nursing, but you can see if you look for submissions, you can see it tells you exactly in preparing what you're going to put in your abstract and how many words it needs to be and what you're going to put depending on what type of article that you submit, research article or DMP quality improvement project. And with this is an example to show you it may be less words than what other journals that you have or other conferences that you're going to submit with. So that is the summary of our presentation. The only other thing that I wanted to add was that for references, you can always check your APA manuals too, because in the APA manual, they actually have in the 7th edition on pages 73 to 74, a list on how to write a proper abstract in APA format. And I also included an article on how to write an abstract to tell a compelling story. It's an article that gives a lot of good background on summaries of what we're saying here. So thank you all for this time. I'd like to open it up now for questions to me or Dr. Kang.
So there was, I added, based on Janisha, I hope that, is it correct? Asked some questions. So I put 2 examples that abstract that I submitted. These actually one one won Martha Hill Award from American Heart Association. One I got also Nursing and Allied Health Award from the European Society of Cardiology. So hopefully this may help you to prepare the abstract. And the questions about can I publish my abstract after submitting in SNRS conference? Definitely, I think you can publish, but not by the time you are submitting, but after submit, I think you can publish it. But if really luckily your publication process goes so fast and then it got published before you really present at the conference, then you need to let them know, you need to notify to conference so that they can work with you about that part as well, because they do not want to publish that is already published, right? So you need to let them know if it is published before. But if it's published after your presentation, definitely that should be okay. And can I put my covariate outcome in results section, whether it is significant or not, besides primary outcome? I'm sorry, but it will be totally depending on your research purpose. If you are looking for some specific one as a predictor of some outcome, then you should not focus on your covariates. But if your purpose or aim was to see what kind of variables were associated with a certain outcome, and that has been to be not your really focus, but some other covariates, like for example, age or sex, and if you think it's important, you can mention it. So it is really based on your purpose statement and what your goal was, right? But if you really did not find anything, maybe you may want to modify your purpose statement, and so that you can kind of put something that you did not really expect to see, but it was still important. And and then also is it allowed to write a manuscript based on the data that I have collected for my SNRS conference? Definitely, I think so. As long as it is, sample size is big enough, and then if it is submittable for the journal, I think so. And maybe Dr. Adorno, Dr. Adorno might be able to say about this part as well. And also, okay, link, I provided it. And also, is it allowed to the inside the reference when writing abstract? I'm not clear about this one. Can you clarify this question again, Janisha?
Yes, thank you so much for explaining. Especially I had like confusion whenever we'll write manuscript, will in introduction background, we'll just add the inside reference like Kate et al. 2018 in the APA format. Is it allowed to use in introduction or background while writing in SNRS conference?
In the abstract? you mean?
Yes, in abstract.
Abstract should not include any references.
Okay.
Mhm.
Okay, thank you. Thank you so much.
You're welcome. And one more, actually, I forgot about the part. If you're talking about your hypothesis, usually hypothesis is a general term, so you need to use a present tense. Some students kind of happen to say like future tense, our hypothesis was like this will mediate with the relationship of this one. But if you are talking about hypothesis, usually hypothesis should be present tense. Darius is asking if the recording will be available. I would think so. What is anybody, Sarah, somebody knows? I think usually it's available to the people who attended, right?
We're recording it and it will be posted on the SNRS website. I'll ask Casey to send out a link to all the registrants once it gets posted. And then someone mentioned about slides, Dr. Kang and Dr. Adorno. Are you okay sharing your slide deck with the attendees?
I think so.
Yes, I'm okay with it. I'll forward you the final.
Okay, perfect. Are there any other questions? I just want to make sure we give everyone a chance to ask anything that might be on their minds as they are thinking about submitting an abstract.
Oh, I have one more to answer. Like Robin just asked, just to clarify, present tense. No, what I meant to present tense was when you are talking about hypothesis. Our hypothesis was that should be present tense, but result section should be past tense, and the conclusion could be like a present tense or future tense, right? Because if you're talking about future study should be something like that, or will be or something, then you may use like should or will or would, something like that, right? And then if you're talking about method, let me see. Right, isn't it? Marie, do you have any
So the biggest thing is talking about the results that you did for your study in past tense because you've completed the study. If the study was in progress when you submitted it, then you use the right verbiage at the time of submission. But at the
yes,
same
that's a very
time,
good point.
when you're talking about your results of your study, usually you're submitting it because you've concluded your study. But
Right.
depending on the section you're talking about, like when you're talking about conclusions and discussions and implications for future practice, then the wording is going to be, the tense is going to be different. If you're reporting on review of the literature, since that already happened, the tense is going to be different. So it depends on what section of it that you're in. You have to make sure that it's just congruent with whatever the activity is you're summarizing.
Thank you. I have one more question. Do we need to write about funding source also whenever we are writing abstract?
Can you say again, Janisha?
Do we need to write about funding acknowledgement also in our abstract for SNRS?
Acknowledgement.
Yeah.
I think I'm not. Right now I'm not 100% sure whether SNRS is asking about funding section, but I definitely know American Heart Association or European Society of America at the cardiology. They have that section while you are submitting. They ask, "Do you have any funding from the NIH or from other places?" And they indicate it. SNRS, I'm not sure, but definitely, if your abstract get accepted, you should put in the poster acknowledgement as
What
funding.
about diagram whenever we are writing abstract? I have seen that you have mentioned about diagram presentation also after funding acknowledgement.
Diagram?
Yeah, about the result section.
Mm-hmm. So result section, you put what you found, but it can be bar chart or survival graph or diagram, anything, it's possible. Also, like Dr. Adorno said, like these days new journals are kind of modifying in a way, not asking only abstract, written abstract, they also ask you for the visualized abstract, which kind of is more like the infographic. So you may need to think about those parts. Abstract changing to infographic is also required in some journals.
And again,
Thank
some
you.
journals have rules to that, how many tables you can have, how many abstract sizes of it, etc. Now, some of them don't address it. If they don't address in an abstract that you need to include a visual illustration, then you just work under the assumption where it doesn't have to be included, but you're following the word count. They're usually very specific to what you should and shouldn't include and how to include it. And someone wrote in here, conferences often don't ask for visual results, and that's true, especially for the abstract, because then usually however you're doing it in the presentation, then it becomes your choice to present the results like that. You're given a summary of the results or the findings in your abstract, but not necessarily a visualization unless otherwise asked for it.
I think it can be more likely related to what I did, like American Heart Association or European Society of Cardiology. They allow you, they are not asking you to include really like a visualized one, but they allow you to include that one. Yes.
Well, thank you
Thank
to
you so
everyone.
much.
This concludes our presentation. And if you have any more questions at all, you can reach out to us at any time.
Thank you, Dr. Adorno and Dr. Kang. I just want